Today's topic is how to become an authorized Medicare supplier of DME. I'll tell you a little bit about myself before we get started. I'm a chiropractor. I practiced for 16 years. About 10 years, I started a company called Target Coding. I am certified in CPT coding, certified in healthcare compliance. I write articles for many different magazines and journals throughout the industry. Member of the ACA and American Academy of Professional Coders. I speak for many different associations throughout the country, many different groups, organizations, state associations, and national conventions. So that's a little bit about myself. So now let's talk about how to become an authorized supplier of durable medical equipment through Medicare. Now, we're talking specifically about getting your DME authorization certification to supply patients with durable medical equipment through Medicare. Now, you may be saying to yourself, well, what happens if a cash patient comes in, or Aetna, Cigna, Blue Cross Blue Shield, United Healthcare? Well, most of these carriers do not require that you have your DME certification through Medicare, but some do. Obviously, a Medicare patient doesn't require that you be certified through Medicare. So I just wanted to clarify. Cash patient comes in, you can sell your patients durable medical equipment. In most states, it's totally appropriate. It's within the scope of just about every practice that I work with. And again, when it comes to regular insurance, your your Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, your personal injury carriers, most of them allow you to supply patients without being an authorized Medicare supplier. So I just wanted to clarify that. Now, let's talk about supplying patients with DME, which stands for durable medical equipment. It could be an overall excellent approach to patient care in your practice. Now, as part of the Medicare Claims Processing Manual, many different healthcare providers can become suppliers, authorized suppliers, like MDs, DOs, DCs, can become authorized suppliers and get a valid supplier number assigned by the National Supplier Clearinghouse. You see, you're going to get your application to become an authorized DME supplier through Medicare goes through the National Supplier Clearinghouse, not Medicare. So let's talk a little bit about DME, durable medical equipment. It's also known as durable goods, medical supplies, and home care products, and they're defined as items or appliances that could withstand repeated use, are primarily used to serve a medical purpose, are most useful to injured or disabled people, are appropriate for home use, and are necessary to improve or enhance one or more typical activities of daily living that the patient may be going through. Now, the accreditation process. Now, for some healthcare providers, you are exempt from the accreditation process, like medical doctors are exempt from the accreditation process. Now, if you have to go through the accreditation process, the federal government has approved 10 organizations. You can only get accredited through the following 10 organizations. These 10 organizations, they oversee the process and determine if a supplier is meeting all the requirements, and then you become accredited. So we have the Joint Commission, Community Health Accreditation Program, Healthcare Quality Associates of Accreditation, National Board of Accreditation for Orthotic Supplies. Those are the first 4. Here are the next 6. There are also the websites, Board for Orthotist and Prosthetic Certification, Accreditation Commission for Healthcare, National Association of Board of Pharmacy, Commission on Accreditation of Rehab Facilities, American Board for Certification in Orthotics, and the Compliance Team. So there are these 10 organizations that you must use one of these in order to go through the accreditation process. Now, some of these organizations, they don't accredit providers in outpatient facilities, simple practices, outpatient clinics. Some of these organizations work directly with hospitals, pharmacies, sleep centers. So there's different specialties within these 10 organizations. Now, I have contacted and reached out to a couple of these organizations, and there's one that I like very much that I would recommend. So if you want the information on the one that I recommend, please send an email to Amy, AMY at targetcoding.com. That's AMY, Amy, at targetcoding.com, and she will get you the information on the organization that we tend to think is the best to use for a simple chiropractic medical practice or a physical therapy practice. So contact us if you'd like to get that information on the company that we recommend. Now, this accreditation process, it takes a while. When you contact one of these companies, you're probably going to have to go through training, 3 to 4 months of training, where you're going to go through all the different compliance requirements. For example, if you give a Medicare patient a lumbar brace, the patient comes in on the next visit and says, I don't like the way this fits. It's too tight or too loose. There's a form that needs to be filled out. This has to be logged in. The complaint has to be filed in your DME compliance book, and you have to take the proper action steps. So there's a whole bunch of these compliance and standards. I think there's 31 or 32 standards that you have to go through and understand them and know how to deal with them when the time arises. So it takes a few months of training. Then the company that you choose to do the accreditation, they're probably going to do a site visit. So they're going to come to your practice, and they're going to make sure that you are upholding the standards and you're doing everything that you've been trained on. You have your hours posted. You have everything listed properly. You have all your logs and forms, and everybody's been trained properly. So they're going to come and do a site visit. Then once you receive your site visit and you receive the stamp of approval that you've been accredited, it usually is for a 3-year period. So the fee that you pay this organization that does the accreditation, it's typically good for 3 years. So that's good. You don't have to go through this every year. After 3 years, you're going to have to go through the accreditation again. Now, some of these companies charge $3,000, $4,000, $5,000 for the accreditation process. So be aware there's a fee. Now that fee, whatever it is, let's say it's $3,000, that covers all 3 years. And some of these companies, these organizations that do the accreditation, they will allow you to stretch the payments out over 3 years. So it depends on the company that you use. So that's typically how the accreditation process works. The next thing you need to be aware of is a surety bond. Enrolled DME suppliers, subject to the bonding requirement, are required to obtain and submit a $50,000 bond for each NPI number. So since DME suppliers must obtain an NPI by the practice location, so example, you have 20 practices, you have 20 locations, 20 times 50,000, you would have to get a $1 million surety bond. If you have one practice, you just have to get one bond for $50,000. The cost is approximately $300, I would say. Now, there is a list here also. Medicare provides you, and if you want this list of companies that have been authorized by Medicare as surety bond companies, send an email to Amy at targetcoding.com. That's AMY at targetcoding.com, and we'll get you the list. Make sure to use a company that's on the list. If you don't use a company on the list, your application may get denied. So there's a list. There's a couple of hundred companies that write these bonds. So not that difficult. It's basically filling out some forms and paying a few $100s to get your surety bond. DME suppliers exempt from the bonding requirement are physicians and non-physician practitioners. For example, a non-physician practitioner is a nurse practitioner, a physician assistant. Those are examples of mid-level practitioners or NPPs. If the DME items are furnished only to his or her patients as part of his or her professional service. So if you're a physician and you're supplying DME to your patients, then you don't need to get a surety bond. Same thing with physical therapists and occupational therapists. If the business is solely owned and operated by the therapist, then you're exempt if you're supplying the DME items to your patients. Next, I need to talk to you, those of you listening to this presentation that are doctors of chiropractic. Well, Medicare recently announced a change. Unfortunately, Medicare announced a change to the processing of DME applications filed by chiropractors. This just happened recently. Doctors of chiropractic are eligible to enroll as DME suppliers, but are not exempt from the accreditation. So you are eligible to enroll as a chiropractor to be a DME supplier, but you're not afforded any special enrollment exemptions extended to other physicians and non-physician practitioners, as defined in Section 1861 of the Social Security Act. So as of June 30th, 2013, June 30th, 2013, up until June 30th, 2013, if you're listening to this presentation and it's not yet June 30th, 2013, you can get your DME supplier number, but when June 30th, when the calendar hits June 30th, you're going to need to get accredited and a surety bond. So DCs are no longer exempt from accreditation, surety bond, site visits, or any other licensing requirements as required for DME suppliers in the state in which you practice. Also, whether or not, as a chiropractor, whether or not you are accredited or not, you must get a written order or prescription from an MD or a DO before you can provide the Medicare patient with a DME device. The reason why you have to do that, because under the Medicare program, the only thing that chiropractors can order are spinal manipulation. Spinal chiropractic manipulative treatment is the only thing that Medicare pays chiropractors for. Now, let's say you are a chiropractor and you don't have your DME supplier number and a Medicare patient comes in and you want to sell the patient a lumbar brace. You can. Just make sure the patient either signs an ABN or some sort of acknowledgement form stating that they are aware that Medicare will not pay for this DME device, and you can have the patient pay you directly. So that's fine. You can do that. But as of June 30th, as a chiropractor, you need to get accreditation and a surety bond. Now, after you go through the accreditation, the surety bond, the site visit, the training, you pay all your fees, you pay all your forms, you get accredited, then the next step is to apply to Medicare for your DME PTAN number. So it requires you to fill out the 855S form. The Medicare 855S form is what needs to be filled out. It's a 39-page application. Now, depending upon what accreditation company you use, you may or may not have to pay the enrollment fee. Medicare now charges a application enrollment fee of $523. That may get waived. Check with the accreditation company you use. You're also going to need to send Medicare a copy of your professional license. You also need to send them a copy of your office liability policy. That is a limit of $300,000 for each occurrence. Contact your liability policy insurance company and ask them to name the National Supplier Clearinghouse as the certificate holder. You also need to send Medicare written confirmation of your tax ID number and legal business name. Now, some offices start to get a little confused and start to get a little frustrated with all these requirements, especially written confirmation of your tax ID number. It's pretty easy. You can call the IRS at 800-829-0115 and get this Form CP-575 or 147C, or maybe your accountant can get it for you. But you're going to need to supply Medicare with confirmation of your tax ID number. Now, the 39-page application is basic information. You need to supply name, address, phone number, Social Security number. You need to supply NPI numbers. There's a lot of information that needs to be filled out, but it's basic. But you need to fill it out. For some offices, it gets a little time-consuming, so Target Coding offers a service whereby we can fill out the application form for you. We can gather your professional license. We can put the whole package together for you and send it into National Supplier Clearinghouse for you. We will call them to get updates on your application, and we charge a fee for that if you want us to do it for you. Or you can have your staff fill out the forms and send everything on your own. That's up to you. Another thing that you're going to have to send in along with the 855S form is an original voided check from the bank that you want Medicare to make your payments. Now, Medicare is going to send the payments electronically, so be aware of that. This voided check must be mailed. You see, you can't do everything online. Some of the 855S application can be done on the PICO's website, so you can go there and fill it out, but there are certain things that Medicare must get a hard copy, like an original voided check and other things, that you can't do online. So that's why we put the whole package together. We fill out the application, not online, the old-fashioned way. We handwrite all the information, and then we send the whole package in for you. Now, once you receive your new Medicare DME PTAN, now remember, this is going to be a brand new PTAN. PTAN stands for Provider Transaction Access Number. So if you're seeing patients and you're billing Medicare for traditional Part B services, you're using your regular Medicare PIN number or PTAN number. Now, once you get your application approved and now you become an authorized DME supplier, you're going to get another PTAN number. This is going to be a DME PTAN number. And now you're going to submit your claims to the carrier assigned to your state. Now, that's going to be different than the Medicare carrier that you are billing your regular Part B claims to. So, for example, let's say you are a doctor in Georgia, and you're seeing patients for regular Medicare Part B claims. You're sending your claims to Cahaba, right? Or let's say you're a doctor in Georgia doing regular Medicare Part B claims. You're sending your claims to First Coast Service Options. Let's say you're a doctor in Colorado. You're sending your Medicare Part B claims to Novitas. It used to be Trailblazer. Things are changing now. But for Colorado, Florida, and Georgia, when you submit your claims for durable medical equipment, you're sending them to Cigna. If you're in Connecticut or New York, Pennsylvania, for example, in New York, regular Medicare Part B, you're sending your claims to National Government Services. When you get your Medicare DME number, you're not sending your claims to National Government Services if you're in New York or Pennsylvania or Connecticut. You're going to be sending them to NHIC. In California, Arizona, you're sending your claims to Noridian. If you're in Illinois, Indiana, Kentucky, a lot of claims from Illinois, Minnesota, you're sending your claims to WPS, right? Well, when you get your DME PTAN number, you're sending them to National Government Services. So a few of the things that you need to be aware of. Now, overall, I think it's all worth it. Believe it or not, I think it's all worth it because it's a very nice additional service to offer your patients. And it pays very well. Nothing wrong with that, right? So here's some general recommendations. Contact the carriers you bill and get their DME documentation and referral arrangement policies and guidelines before you start billing. Don't create cookie-cutter DME orders. For example, every patient that comes in is going to get a lumbar brace, a TENS machine, and a home traction unit. Don't do that. Or day 4, on every patient, they're going to get an ankle orthotic. No, it has to be medically necessary. You want to make sure that your documentation creates a breadcrumb trail leading up to the ordering of the DME. You should have a letter of medical necessity in your documentation, in your patient file. If you have a letter of medical necessity, it may be able to, you could use it to help appeal any denials. Now, if anybody listening to this webinar would like a sample letter of medical necessity for durable medical equipment, send an email to amy@targetcoding.com, AMY@targetcoding.com, and we can send you a sample letter of medical necessity for durable medical equipment if you'd like to see that. Now here, this is important. This is part of the definition of medical necessity according to the federal government. The services, the procedures, the supplies, the DME must be reasonable and necessary for the diagnosis or treatment of illness or an injury or to improve function of a condition. So the diagnosis codes you use and bill are very important. And for many of these durable medical equipment devices, there are certain diagnosis codes that work best. So if you go to the Target Coding website, you'll see a book that I've written on durable medical equipment billing, coding, and documentation, and I supply you with a whole bunch of diagnosis codes that work best for certain DME devices. So you could go to targetcoding.com and check that out. And just a few closing comments. You must check with all the carriers you bill prior to submitting claims based on the information provided in this presentation to ensure that it is compliant. Target Coding doesn't guarantee that the information provided in this presentation will guarantee payment from any insurance carrier or patient. So please do your due diligence, do your homework. This is an excellent way to get your patients to feel better and also a great way to add additional income to your practice. So, Dr. Siegel,